Thank you.
Thank you so much, Dr. Nikhil sir, for the kind introduction. Thank you so much. And at the outset, I'd also like to thank AIOS and Ajanta Pharma for this opportunity. And this is a very different topic that we would be speaking today on, the dry eye practice in today's scenario. Are my slides visible?
Yes, ma'am.
Yeah. So this was the headline in one of the leading dailies in 2019. India on the brink of a dry eye disease epidemic, said the study. And what it said was age, urban residence, occupation, and socio-economic affluence were among the risk factors. It predicted a prevalence of almost 40% of dry eye by 2030 in urban population. And this was carried out across India, and the results were published in the Ocular Surface. Now, we all know a lot of risk factors for dry eye disease, including contact lens wear, smoking, exposure to digital devices, and air pollution, and so many other reasons. Now, a fast track to June 2021, and this is the changed headline. Indians suffered maximum damage to eyesight, and this is what the corona pandemic has done, and it has increased the toll on the eyes, especially with regard to dry eye disease. A very interesting nomenclature was here published in this article called as the quarantine dry eye, which basically gave us the implications of the lockdown in the COVID-19 disease and its implications on ocular surface health. Now, during the corona pandemic, a big global change that has occurred is a series of containment measures and lockdowns, curfews, stay-at-home orders all over the globe. Now, this global lockdown has ensured that around 3.9 billion people worldwide, which went under lockdown, and the entire world was suddenly changed into a virtual world. So there was temporary closure of schools, universities, colleges, offices, and industries worldwide. So now what is the connection with dry eye? Let us see how this has increased the predisposition and risk factors for a dry eye disease. Now we also have today, because of the disease pandemic, environmental changes, modifications in personal behavior, abuse of digital devices, malnutrition, including vitamin deficiencies and essential fatty acids, sleep and psychiatric disorders, and mask-associated dry eye. And one interesting syndrome is the sick building syndrome when you're confined to your house. So when we're talking about the quarantine dry eye, it's basically a new phenomenon which has suddenly caused an increase in the number of dry eye patients all over the world, and probably because of restrictive measures that could be recursively extended over time, considering the third wave or the fourth wave that could be possible in the next few months. We all need to be very wary of this situation. Already in my practice, I have seen a huge increase in the symptomatology of dry eye in patients across ages. Now, what has significantly increased is the use of video display terminals. It's basically a new lifestyle, not only for adults who started working from home, but also for the school children where there are online classes and college going students. There is basically prolonged near work, and this has increased the predisposition to ocular surface disorders. This was an article which showed an interesting statistic which showed that the use of PCs, smartphones, tablets has increased by a whopping 300%. And this increase of screens probably has exacerbated the increase in the dry eye disease. Now, how this has done is basically because of the reduced blink rate, incomplete blinking, which we all know increases evaporative dry eye. The prevalence of dry eye has also been seen very high in the pediatric age group. Now, in this age group had been relatively, safe from the dry eye, and we always had thought that dry eye is something which is basically with respect to the postmenopausal females with diabetics and thyroid disorders. But the corona pandemic has shown us that even in the pediatric age group, especially with increased use of smartphone in urban areas, and the reduction in the outdoor activity has increased the prevalence of dry eye disease. Now, this was a study that was published by Dr. Titial sir et al., which showed that the prevalence of dry eye disease in North India is as high as 32%, and the exposure to video display terminals, smoking, and contact lens use were the greater risk factors. Now, because of work from home and a constant connect with technology, even though you're at home, this has given rise to what is called as probably the office eye syndrome, Where there's more of sedentary behavior, you're not allowed to go out, there's reduction in physical activity, you're not going out for walks or even exercising. So basically a sedentary behavior which has increased, and exposure to low humidity, air conditioned environments throughout the day, which probably has increased the exposure to dry air and then causing a change in the tear film because of an evaporation of the aqueous layer. Now let's look at what are the dietary implications of the COVID times and its relation to dry eye disease. There has been a significant change in the eating and drinking habits secondary to lockdown. Now, not only there is closing of the restaurants outside, but more time spent at home and more time spent not only preparing and cooking and eating, probably in order to improve our feel good factor, there is probably a greater tendency towards more of fast food. And also this could cause main nutritional deficiencies associated with dry eye, especially with respect to lack of vitamin A, vitamin D, and essential fatty acids. So if there's a diet which is poor in vegetables, fruits, low intake of vitamins and antioxidants, along with a reduced physical activity, could push a patient towards dry eye. Also, probably because of the lockdown, inadequate availability of fresh ingredients could probably increase the use of frozen foods, which are lower in nutrition. Also, because of the lockdown, there has been a disruption of the work routine, more of boredom, and probably becoming a couch potato. And this causes more of increase in macronutrients, increase in intake of carbohydrates, and this has a greater tendency to develop obesity. So basically, how obesity acts is basically it's a chronic state of inflammation which has nutritional deficiencies, and plus because of binge eating and because of eating fast food, there could be dehydration, and all this could increase in the amount of dry eye disease also. Also, lockdown related emotional stress, psychiatric problems could worsen the kind of the psychiatric behavior, and the increase in food intake secondary to these emotional tensions could also increase the amount of sugar rich food that are increased and causing dehydration and as well as nutritional deficiencies. Probably a greater increase in alcohol consumption has also been seen in this period, especially because of social isolation and economic uncertainty, and patients going into depression and negative reinforcement in order to escape stress. And recent studies have shown that alcohol consumption may be a significant risk factor for dry eye. So when it comes to sleep and psychiatric disorders, all of us know that because there is no specific work routine, there has been a disruption of the sleep cycle also. Again, uncertainty related to the pandemic because of fear, anxiety, worry, stress has seen an increase in depression, especially in the US, where it was found to be threefold higher during the pandemic than it was earlier. Also, it has pushed people into probably substance abuse and elevated suicidal tendencies. A lot of ophthalmologists also, especially younger ophthalmologists or people who have just started practice and who have been suffering a lot of economic burden and financial crisis, have been pushed into anxiety and depression. How this affects probably dry eyes, an increase in the amount of neurological and psychiatric medications, which could act as a risk factor for developing dry eye. Again, disrupted sleep rhythms and insomnia can disrupt the lacrimal system, increased exposure because people keep hooked on to their mobiles or laptops or the television. So increase in the exposure to blue light causes a melatonin change in the cycle and the cycle of sleep disruption, which increases the amount of eye fatigue. A very specific kind of problem here is the mask associated dry eye. This was an interesting article in the IJO where they said there was a mask associated dry eye disease could be probably a dry eye epidemic during the COVID-19 era. This was another article which said the self-reported symptoms of mask-associated dry eye in a survey study of almost 3,600 people, and it was found that there was a marked increase in dry eye symptoms among regular mask users. Now, one of the important reasons is because there is a space between the edge of the mask and the face, the air from the breathing, that is when we are breathing out, could be channeled up on top of the face mask and over the surface of the eye, causing tear evaporation and leaving the surface dry. So probably taping the mask at the edge on the top of the mask could help, and also patients being counseled regarding it and regular monitoring of these patients. So lubrication and lubricating eye drops and using a very well-fitting mask could probably be one of the solutions, and limited time in air-conditioned environments, and basically explaining to the patients the possible problems due to long-term mask wear, though that is the most important way of how we can prevent COVID-19 infection from spreading. So basically what we need to do is an early and timely detection by identifying those who are at risk, screening these patients, counseling them, and then treating them at the right time. So what our goal should be is to reduce the emergence of risk factors as far as possible, reduce the prevalence of complications and disability. So we need to target these populations who are susceptible and pick them up early, even if they are asymptomatic. And those who are symptomatic, definitely screen them and treat them accordingly. So what we are doing in our clinic is basically all those patients who are symptomatic with dry eye symptoms, we are exposing them and doing dry eye protocol for these patients to look for evidence and signs of dry eye, especially with regard to evaporative dry eye and MGD. Those patients who are at high risk, like diabetics, thyroid disorders, postmenopausal females, those who are going to be operated for refractive surgeries and cataract surgery, especially the premium multifocal and the toric IOLs, glaucoma patients who are under chronic anti-glaucoma medications, contact lens users, and those who are exposed to digital devices for more than 2 hours per day are the special subset of patients who should be screened for dry eye disease. So basic dry eye protocol has to be done by all of us as ophthalmologists, like doing an OSDI score or any kind of scoring system that you can do, and then compare it pre and post treatment, a tear breakup time, Schirmer's test, and a myography just to begin with. Education of the patient regarding changes that they can do in their routine homes and when they are working on their PCs, laptops, should be explained to the patient, especially like the 20-20-20 rule, or adequate and complete blinking, use of lubricant eye drops, keeping a good posture, and how they need to keep the proper distance from the PCs has to be explained to the patient. Now, all those patients also who are continuously using mobiles, because mobiles is one of the important digital devices people are using even for their businesses, has to be explained how they can change the screen tone and the display, how they can improve their screen brightness, adjust it according to the level of the room light, improve the contrast as much as possible, however, reducing the eye strain also, using humidifiers for dry and warmer rooms. Now, when we are following the TFOS guidelines, for these patients, remember, of all these asymptomatic patients also, if they have risk factors, look for signs. If there are signs, then they need to be explained regarding what are the environmental modifications they can do. In those patients who are symptomatic and also who have signs, definitely treat them according to whether they are evaporative or aqueous deficient dry eye. And if there are no signs at present, keep looking for them, and then also offer education and preventative therapy. Now, once they are identified in the OPD, go ahead with triaging questions, look for any other risk factors, like for example, any systemic risk factors, and then refer them to a rheumatologist for further treatment and management. Depending on the risk factor analysis and the symptomatology, various other tests like the tear breakup time or the osmolarity, the ocular surface staining, divide them between the evaporative and aqueous deficiency dry eye, grade them according to the severity, and then depending on the severity also start the proper treatment in the form of tear substitutes, especially the non-preserved ocular lubricants and the overnight ointments, and probably very low anti-inflammatories like low steroids or cyclosporin, or even the higher treatments like the expression of meibomian glands, intense pulse light therapies, or the LipiFlow for MGD. Now, basically, there could also be, due to COVID times, a greater financial burden of therapy on these patients with respect to buying the over-the-top medications for lubricants. And this has to be continued for a longer time. Increasing costs due to therapies like the IPL and the LipiFlow may prevent them from taking this treatment, and that is why they need to be counseled regarding that. So to conclude, what we need to do and what has changed in my practice over the last many months after the onset of the corona pandemic is basically we are monitoring closely various age groups for dry eye disease. So it's not just the higher age groups that we were seeing earlier, but even children, young adults, or those who are um, computer users for a prolonged period of time throughout the day. This quarantine dry eye is probably likely to reduce the quality of life in all these patients, and drastic reduction in the work and school efficiency could be one of the things that we might see in the time to come till the corona pandemic actually leaves us. So for all these patients, timely diagnosis and timely treatment may promptly help us to limit all these problems. Thank you so much for your kind attention.